When you are faced with a cancer diagnosis, finding a treatment, it can be scary, especially because there are so many choices. An important factor is finding a treatment without many side effects. This is Dr. John Kressel of Phoenix Cyberknife Center. He's here to tell you how he and his team can help, and we are always fascinated by Cyberknife. Tell those folks at home what it is that you do.
So the Cyberknife Center is a center of excellence for radiosurgery, which is the most advanced form of radiation therapy, which is one of the three main components for treating cancers: surgery, radiation, and chemo. And radiosurgery is the most advanced form of radiation, very pinpoint, very precise, so we basically spare or avoid treating healthy tissue.
Yeah, we've heard from testimonials, we've heard patients come on the show and talk about the treatment. They were relaxing. They said it was just incredibly comfortable. Talk about the treatment. What is it like? What does it feel like?
Well, unlike standard, more common radiation therapy treatments, it's only one to 5 treatments, so it's all done in a week or less.
That's mind-blowing.
Yep, very pinpoint. So a lot of times the side effects are greatly reduced. A lot of patients that we treat, for example, a lot of gentlemen we treat in the morning for prostate cancer or something else will go golfing in the afternoon.
Yeah, they're up on their feet and they're able to do this in a week or less, because some of these diagnoses, when they are, stage 4, stage 3, it would have taken months, to go through some sort of recovery, but not with you all at Phoenix Cyberknife. And you guys are not only unique here to Phoenix, but you're unique to treatment centers around the country. How so?
We were the first in the world to have 2 treatment devices side by side, the Cyberknife and the TrueBeam STX. So we had all of the capabilities of every form of radiation therapy, specifically radiosurgery, that could be provided. So there was no shortcuts. We didn't have to send patients anywhere else. And in fact, next week we're even adding a new technology. It'll be the 15th in the world and the first in the Southwest, which is called HyperArc, which is another form of radiosurgery to treat pinpoint brain metastases very quickly, very efficiently.
Wow, that's huge. That's huge news for folks who are suffering from brain tumors. And you said it doesn't matter if it's benign or malignant, correct?
That's true. And the bigger thing is this can avoid whole brain radiation therapy, where the entire brain is treated in a lot of normal healthy tissue. So this is a treatment technique that we are happy to offer to the community. A
lot of folks have questions, of course, when they hear, yes, you have cancer. Side effects. That's one of the top things that people ask.
Yep.
Are there side effects with Cyberknife?
There's side effects with any form of treatment, for sure, but they're greatly diminished compared to other forms of radiation therapy if you can avoid treating normal tissue. But it depends on are we treating a brain or a lung or breast or prostate. So there's different side effects depending on which disease site we treat. But most of the time they're pretty minimal, not a lot of recovery. And like I said, for example, our prostate patients or even some of our brain patients get treated in the morning and then go golfing or go back to work.
Right, just getting back on with life.
Yep.
A lot of people, of course, as you know, make this decision based on whether they can afford the treatment. Do you all accept insurance?
This is covered by insurance and Medicare. It's the preferred or the most recommended treatment for a number of disease sites, particularly lung cancer. So it's very common. Yes, it's covered by insurance.
You've named a lot of cancers in this short time. Do you treat everything?
The Cyberknife can be used from everything from head to toe. So it's very important to understand if this is an option for you. That's really our biggest mission, is making sure that patients are their own advocate. Many times even their own physicians aren't trained in Cyberknife, so they can't really provide the recommendations or the expertise as to if they're a candidate or not. So happy to see those patients and give them an option of that they may not know about.
What sets your physicians and radiation oncologists apart from others?
Well, that's the biggest part, is that trained and experience in Cyberknife radiosurgery. That's just not something that's common. There's not a lot of Cyberknives or experts in radiosurgery, so it's important to have that type of physician provide you that input versus somebody who hasn't had that training. Right.
At the very least, get a consultation and bring your questions. Dr. Kressel, thank you so much. If you have any questions for Phoenix Cyberknife and Radiation Oncology Center, you can email them at info@pcroc.com. They're located at 4611 East Shea Boulevard in Phoenix. Give them a call today to book an appointment, 602-441-3845, or visit phoenixcyberknifecenter.com.